promise. So welcome everyone. I'm Elise Washington. I'm a project manager supporting Missouri Healthy Schools. Missouri Healthy Schools provides students with lifelong advantages built on early positive health behaviors that improve the conditions for academic achievement. I encourage you to check out the website mohealthyschools.com for more info about programs and resources. Today, we're really excited to have Dr. Sherri Homan back with us to present part 2 of how to communicate COVID-19 research and guidelines, tips and tools for school leaders. And today she's joined by Dr. Elizabeth Friedman. As I start their introductions, I encourage you to drop a note in the chat with your name, where you are geographically, and your organization or role. You know, we want to know who our audience is today. Sherri Homan is a nurse practitioner, an epidemiology consultant, a nurse scientist with National Cancer Clinical Trials Cooperative Group, that's a mouthful, and adjunct faculty at the University of Missouri Sinclair School of Nursing. Dr. Homan is a former chronic disease epidemiologist with the State of Missouri Department of Health and Senior Services and has more than 25 years of experience in public health. She provides epidemiologic and evaluation services focused on impact, prevention, control of chronic diseases, and other health issues. She's joined by Dr. Friedman. Prior to a career in public health and medicine, Dr. Friedman worked in adult education in St. Louis. She then received extensive medical training in adult medicine and pediatrics, as well as reproductive and pediatric environmental health and occupational and environmental medicine. As an environmental health and exposure medicine specialist, Dr. Friedman serves as the Region 7 Mid-America Pediatric Health Specialty Unit Director, and also as the medical director for the environmental health program at Children's Mercy Hospital in Kansas City. We are in webinar mode today, so that means your video and mics are automatically off. But if you have questions throughout, feel free to put those in the chat or the Q&A box, and I welcome you to this webinar. Thank you.
Okay, I'm going to share my screen. Good morning, everyone. We're going to start this part 2 of communicating COVID-19 research and guidelines, tips and tools for school leaders. Part 1 was recorded a few weeks ago. I have no conflicts of interest to disclose. So today for the overview, I'm going to give a brief update on COVID-19 and a little update on vaccines. There's been some occurrences since we last talked. Also want to talk briefly about healthy buildings, HVAC systems, and resources. So again, describing diseases in populations, we often look at the number of cases. That gives us an idea of the extent and patterns of by time, place, and person. It also shows us where the clusters and the outbreaks are occurring. And in the United States, we now have greater than 26 million cases, more than 400,000 deaths. And the map shows active cases. And this is from the Johns Hopkins University dashboard. And this is active cases as of January the 29th. And what you can see in the United States, we still have quite a few outbreaks and large number of cases throughout the United States. In Missouri, located right here in the middle of the state, we have approximately 470,000 cases that have occurred and more than 7,000 deaths. So we're still in the midst of this pandemic. When we look at our picture over time and the trends that's been happening, we do see the daily cases. We can pretty much see what has been going on. And if this diagram went back further, you'd see the plateau that we had over summer, which was pretty low, and you can kind of see it in the Missouri data. But in the United States, you can see where when we started letting up on our precautionary measures, we started seeing spikes occur. And then when we hit the holiday seasons, you can see that we really had a wave that occurred from Thanksgiving and the other holidays. You can even see this real light spike that occurred here, and that was almost 2 weeks past Thanksgiving. So you can see we had quite a bit of a wave that happened. And then with the cases came the spike in hospitalizations, which was a huge spike in our hospitalizations, again, related to what was going on over the holidays. And the deaths also spiked, but not as bad. But what you can currently see is that we're starting to come down off of that spike now, and things are starting to plateau, but higher than where we were this summer. So the SARS-CoV-2 virus is a small virus that causes severe acute respiratory syndrome, or coronavirus 2. But it is a small virus, about 0.1 microns. You can see really small here. It's spread by droplets and aerosols, droplets being a little larger than aerosols. And then the particles that are emitted go 6 feet or further, depending on how they leave the body. So the diagram to the right shows in the event of a sneeze, you can see all the large droplets and the aerosols being put out into the air. Now, the larger the droplets tend to not go as far and drop to the floor or other surfaces, but you can see this plume when you sneeze, just how far these microviruses can go. The smaller the virus, the more deeply they can embed in the lungs. So setting up a really bad lung infection deep into the lungs. So this is why the 6 feet social distance came about. But you can see that there are many, many particles. Now, how many particles do you need to inhale in order to set up a disease? We don't exactly know, but we do believe somewhere around 300 or more will set you up and make you susceptible to developing a disease. But just wanted to show you just how far the viruses, the particles can travel, and that when they do land on surfaces, and we call this fomite transmission, you pick those up, and then that's how indirectly you can also contract the disease or be infected. Also, these particles that land on the in carpeting or on the floor, they can be re-emitted into the atmosphere again with certain activities, walking, movement, maybe vacuuming, different things that can also put them back into the air. So the virus, we've heard a lot over the last couple weeks about the virus mutations. And this is a natural phenomenon that occurs with viruses. They mutate over time. So some of the mutations, there are no consequences. They just mutate. And then there are those that the mutations are negative and they may disable the virus. They may keep it from replicating. They also may cause the virus to die. But then the ones we tend to be very concerned about are those those viruses that mutate and they are adapting. They are becoming more efficient at transmission, at severity, and also may become resistant to some of our medicines. So these are the properties that we are concerned about when viruses mutate. So far, there's been at least 3 to 4 mutations that have been documented. The one you've probably heard most about is the United Kingdom, followed by the South Africa variation, and then also the Brazil has documented 2 different variations. P1 seems to be the more concerning, but there's also a P2 variation. So we are attempting to outrace these variants and getting everyone vaccinated because we still believe that the universal precautions and vaccines combined with the vaccines offer the best level of protection. So talking more about the vaccines, and you've seen this slide before, but there's been a few updates with the Pfizer and the BioNTech and the Moderna, which are the newest line of viruses, messenger RNA viruses, vaccines. They've actually started releasing some of the dose efficacy numbers. With the first dose, Pfizer's about 50 2% effective, and then with the second dose, 95%. Moderna is about 80 with the first and 94 with the second. So this just gives us an idea of how effective the viruses are going to be. The vaccines are going to be against the viruses. And then there are other types. And then the one I want to say more about is the viral vectors. Those are our older types of vaccines, and they've been around quite a while. So AstraZeneca has just been authorized by the European Union to begin vaccinating there in adults 18 and older, and about 60% effective, which is still really good. If we hadn't seen the effectiveness on the new mRNAs, we would say AstraZeneca is really good. These are still really good effectiveness percentages, even though it seems like not. And Johnson & Johnson did apply or will apply soon for emergency authorization. One good thing about the Johnson & Johnson vaccine is that it only requires one injection. And again, it's about 66% effective globally, but about 72% in the United States to moderate to severe disease, and really is very good at preventing severe disease leading to deaths. So Janssen is also testing a 2-dose vaccine. And then one of the other really good developments is that although Sanofi's vaccine has not gone forward with their clinical trials, and they're going to restart their clinical trials, they have teamed up with Pfizer and BioNTech, and they are currently going to start manufacturing the Pfizer-BioNTech vaccine, which is really a good development. So that should put more vaccines out to be administered. Moving on to healthy buildings, these are the universal precautions that we're taking in every building. And you've heard a lot about the hand washing, at least with soap and water for at least 20 seconds, using personal protective equipment, mask, gloves, even though, you know, some people would rather not wear the mask, it really is protective. And you have a mask that has at least 2 layers. One layer gets you around 30% effective. 2 layers get you more around that 90% effective against contracting the virus. And then we want to maintain our social distance, 6 feet apart. Cleaning and disinfecting goes hand in hand with all the other measures. Cleaning and disinfecting, you want to clean, and before you disinfect, you want to get the dirt and all of that away and then disinfect. And that goes a long way to reducing the viral loads within indoor environments. And then heating, ventilation, and air conditioning systems, our HVAC systems, also play a part in how the virus is moved and transmitted and those things. So we want to increase our fresh air ventilation. They give us temperature and humidity control, as well as there's other new technologies coming on the market, things that can be put on door handles where you're not actually touching the door handle, touchless entryways, elevators, lavatories. So if you don't have to touch the surfaces, less likely to pick up viruses that have landed, or the fomites that have landed on the different surfaces. We also want to minimize exposure. Even though I know it's been really tough on the kids and the teachers for the virtual time versus in-seat time, we do want to limit general exposure as much as possible. If that's also doing one-way entryways or hallways and exits. And then we want to introduce as much structural and environmental controls as we can to create our healthy buildings. And that takes a lot of different things, you know, particularly like nurse's office, choir and band rooms, we need to take special precautions. Any aerosol generating activities, such as if you give someone a breathing treatment, that is an aerosol generating. So we have to take special precautions for those different activities. Now, this is a case that was in cited in the literature early on about a HVAC system that they think was hypothesized to be associated with a COVID-19 outbreak. And what it was there's an air conditioning unit that had an intake and outtake flow right above table C. These are tables in the restaurant. And the airflow was going across these 3 tables. What happened was this family had just returned from Wuhan, China, and believed that this index case, A1, was infected somehow in that travel. And then they came to this restaurant for lunch and were there quite a while. And so you can see that either directly or indirectly, approximately 9 more people were infected with the virus across these 3 tables. So the airflow it has been hypothesized that the airflow from this air conditioning unit, which was described as, the ventilation was described as not good, may have helped infect these people across these different tables because of the airflow. But other contributing factors could have been the people moving about, touching surfaces used in the restroom, and being in close contact may also have contributed. But none of the other people, and it was 60 to 70 other people at 12 tables and the staff, none of the other people were infected that we know of. So it was thought that the air conditioning played a role in the people being infected with the virus. So HVAC systems, as I said, maintain temperature and relative humidity at healthy and comfortable levels. And we don't want to give up our comfort, but we also want to make sure that we're safe as possible. The HVAC systems dilute concentration and filter these particles from the air. And filtration is one of the most common methods used for air cleaning. This slide shows MERV filters, which are minimum efficiency reporting value filters. And that just says how well are they filtering particles from the air. And it depends on the size of the particles, as I showed you before. So these filters, and I looked at the smaller particle size, 0.30 to 1.0 microns, which is very small. You can't see these particles with the naked eye. But it shows you that MERV 13 to 16, the efficiency is pretty good for these particles. So ASHRA, which is the Association of American Society of Heating, Refrigerating, and Air Conditioning Engineers, recommend we use filters, MERV filters that are 13 or higher in our HVAC systems. And you can see the higher the filter, the better the filtration is going to be. And then it's also recommended that we use maybe portable HEPA filters, high efficiency particulate air filters, to even give greater air cleaning in certain areas. So as far as recommendations go for HVAC systems, I've already talked about the MERV filter 13 or higher, depending on the system capacity. If the filter is too high, it can actually damage the system because it can't produce the pressure needed to put the air through those filters. So you have to consult with an HVAC licensed professional and review the specifications of your system to see exactly what it can handle for enhancements. And you also may want to take some baseline measures to see, when you do make these changes, do they really work? Do they really improve the air quality? Looking at like CO2, particulates, different things within the system. But the HVAC professionals can help with that. So we also recommend that airflow have the systems turned on and have run times continuously or as much as possible to bring in more outdoor air to dilute and remove the particles. That the HVAC systems run at least 2 hours prior to and after being the space is occupied, and continuously when occupied, and that there is as many air exchanges within a space as possible, preferably 6 or more, that whole air is turned over in 6 times or more within an hour. We need to adjust our temperature and humidity to reduce the virus survival and prevent mold and other contaminants from proliferating. And then we want to make sure that there's a separation between our outdoor air intakes and the exhaust coming out of these systems, and that those areas are cleaned regularly. And that we would also want to ensure that the condensate pans are draining and that we don't have standing water in our systems. Maintenance should be really driven by the need and routine schedule. And there's certain things that need to be done daily, weekly, monthly, annually. And we really encourage every school to put forth those plans and have those plans available for people to know how the system needs to be maintained. And improvements really depend on, again, the system capabilities, what's going on in the outdoor environment. There's sometimes when you can't have your humidity at a certain level or the temperature at a certain level, depending on the outdoor environment and if there's other contaminants in the outdoor environment. And then safety concerns, we always have to consider if we have a lot of asthmatics, people with asthma or other conditions, and how those systems are affecting people with other underlying conditions.
Sherri,
Yes.
we have one question in the Q&A I'll read for you.
Okay.
How effective are plexiglass barriers at blocking the transmission? And then sort of a two-part question. Are there at-home HEPA filters that people can buy, and are those effective too? I know we're talking about schools, but I think there's some interest too in their personal lives.
Okay, yeah, and plexiglass, yes, they can be effective. They need to be high enough above the head that they protect when the person that's behind the plexiglass, and that if there are openings, that those be as small as possible. But you want them above the head enough that the particles aren't going over the top, but not so high that they hinder the airflow. So there are some guidelines out there about plexiglass and some research about that, and I can give you some more of those references if needed. And then about HEPA filters, yes, HEPA filters are they do make HEPA filters for in-home use as well as commercially, and those filters do help to reduce particles in the air. And one of the things that I heard on a webinar was not to put your HEPA filter in a corner. It really needs to be center focused if you're using it in a classroom or in your home, so that it has the wide advantage of getting as many particles as it can out of the room and not just over in a corner. So yes, although I don't endorse specific brand names for the HEPA filters, they do make them for homes, and they're pretty inexpensive. We're talking $100, $150 or so for the home-based HEPA filters.
Thank you.
Sure. So, and then going back to school buildings and in your home, if you'd like, you can use your exhaust fans in the lavatories and the restrooms or in the kitchen areas to expel indoor air directly to the outside, away from people and away from animals. So the other thing for classrooms is that you want to keep your ventilation ducts and your areas clear, and not only to increase the efficiency of the HVAC system, but when those systems and when the areas need to be clean, it just makes it easier to clean these areas and disinfect them when we don't have as much clutter and everything around. So this just shows the schools and universities guidance from ASHRA, and down here at the lower area, you'll see it talks about student health facilities and those precautions that I talked about earlier. You can read about those precautions that should happen in those areas, and like in the wait areas, or if you have a sick child, you can look at those precautions there. But it also goes through HVAC systems and air handling and it also has checklists for unoccupied buildings. So this is a great guidance for schools and universities. But as far as best practices go and tips and tools, you have to adapt these guidelines to be feasible, practical for your school and for your community. So they can be tailored to to your specific needs and be adapted depending on the level of viral transmission in the school or throughout the community. And then we do encourage schools to work closely with state and local public health agencies. These are some other resources, guidance for reopening buildings after prolonged shutdown and reduced operations, should that be the case. And then also there's a very good guidance from the Environmental Protection Agency on maintaining or restoring water quality in buildings with low or no use. And that's very important to prevent not only COVID-19, but to prevent some other diseases that can be waterborne. These are 3 new articles that just recently came out talking about schools and transmitting SARS-CoV-2 and their experiences. And basically what they are telling us, that is, if we are using all of the different layers of protection, the mask, the other washing hands and all the other precautions, that the transmission in schools has been fairly low. So I just gave you the references so you can go out and look at these different articles. And then our resources, these give you more information about different resources that I've talked about today. So I want to thank you, and that's my email address there. And I know together that we can do this. So we just have to stay the course and stay vigilant during this pandemic. Okay, I'm going to stop sharing, and I'm going to turn it over to Dr. Friedman. I think you're on mute, Elizabeth.
Thank you. All right, I'm going to share now. I see some familiar names from yesterday. It's very similar. Okay. So I guess I deleted that intro slide, but yeah, I'm putting in a shameless plug for the Pediatric Environmental Health Specialty Unit. We are federally funded, mostly pediatric, but environmental health specialists at academic centers around the country. And we provide, I wouldn't say free consultation because you've already paid for it with your taxes, but we provide consultation around any environmental health concerns for Nebraska, Kansas, Iowa, and Missouri. Here's our 1-800 number. Here's our email. And please feel free to use our services. That's why we're here. All right, so this is my outline, why we're having this talk today, and devices marketed to eliminate COVID without the HVAC system, since Sherri covered that. So, there was a consideration of talking about, cleaning supplies and chemicals, but we are covering the different devices instead, in part because, we have this virus, it's transmissible between human beings, including children. We know that schools have been given a substantial amount of funding that they have to spend within a certain time. And we just want to make sure that you spend it wisely. There are a lot of predatory companies out there, and we want to ensure that you all at least know the basics around these devices, where to go in the future to answer your questions about these devices and chemicals as well. And this at the bottom here is a list of organizations that will provide some validation or information on the devices that we're discussing. I will put this information in the chat box later. So this is a list of devices that we're going to talk about today. I want to emphasize that none of the devices mentioned here in my section have been identified as a gold standard for removing COVID-19 risk from the workspace. None of these devices have been identified as a gold standard for removing COVID-19 risk. Other than an up-to-date HVAC system like Sherri discussed, none of these are recommended by public health authorities as a way to mitigate the spread of COVID-19. And some may in fact pose risk. So please use the resources that we're sharing with you today to make sure that you're investing in a worthwhile materials. Oops. Okay, so Sherri did touch on some of this information, but I'm going to go over it again. So there are a variety of in-room air cleaners. The most commonly seen, the most marketed, I would say, are in-room air filtration systems. This is one in my home with my doggie. And these work by increasing airflow in a room, which Sherri talked about being important, and also filtering for particulate. And you can see some of the particulate that these filters sucked out of our air. Air cleaner brands, when you're buying them, will list the contaminants that they are effective against. For example, smoke and dust. I use this plus a few more during the fires on the West Coast. And when my asthmatic father came to visit, he was able to breathe comfortably indoors. So when you're looking at devices, you look for devices that list viruses. Devices that use HEPA filters remove over 99% of the particles, 0.3 micrometers in size and above. And while that doesn't cover the virus, it does cover the droplets that contain virus. Things that you want to be mindful of when you're looking at these machines: overloaded filters might not function properly. So in this case, when you're shopping, you want to look for an appropriately sized cleaner. That may be described with a variable called the clean air delivery rate. But then after the technical language, it will say something like, this is appropriate for rooms sized 1,200 to 1,600 square meters. So that's what I go by. Another thing to be mindful of is that changing filters can result in a user being exposed to the pollutant that's been accumulating in these filters. So proper PPE should be worn when performing maintenance. And last but not least important is that if you're going to use these, they still need to be used with the other controls: masks, hand washing, social distancing, etc., in order for them to be effective. So this is our image showing how a HEPA filter works. But I actually was going to tell you about a study that was done recently in Germany. It has not been released in peer-reviewed literature. The authors shared it prior to publication. Basically, they tested the efficiency and practicability of operating 4 purifiers with HEPA filters in one high school classroom while classes were taking place. So they had one classroom with HEPA filters and one classroom without, actually a few with and a few without. And they reported that the concentration of the aerosols floating around in the room reduced by more than 90% within 30 minutes when running these air purifiers. And based on their modeling, they report that staying for 2 hours in a closed room with a highly infected person, they estimated that the inhaled dose for people in that room is reduced by a factor of 6 when using air purifiers, which is pretty substantial. Again, not recommended by public health authorities as any gold standard, but potentially a valuable tool. So I'm going to talk about UVC lighting. We're going to go back, way back to high school and middle school science. So when humans see stuff, whether we see colors or light, we see light with wavelengths of 400 to 700 nanometers. And there are other wavelengths of light, so much shorter wavelengths, if I'm getting that in front of the camera. So shorter wavelengths include UV light, and UVC light has a range of 100 to 280 nanometers, and UV germicidal irradiation, which is sometimes used interchangeably with UVC light in the literature, is 200 to 320 nanometers, and that sweet spot is 254 nanometers. So when we're talking about UV germicidal irradiation, usually it's around that 254 nanometers. Germicidal irradiation has been used to control respiratory diseases, especially things like TB, in healthcare and other high-risk settings like prisons. It works as a disinfectant because the irradiation light from the irradiating light causes damage to cellular material like the DNA or the RNA of bacteria and viruses, and that prevents the organism from reproducing, making it non-infectious. It also causes cellular damage to humans, specifically the skin and the eyes, so mucosal tissue. And that can happen in seconds. So this is not without risks. And also depending on the efficiency of the light being used, the age of the bulbs and how it's being used, if it's being used properly, things like ozone or other chemicals can form in the air depending on what else is floating around. And ozone, we know, is a harmful chemical. So it's something we want to avoid exposing people to. So how do we use it? UV GI can be used in a range of applications, by irradiating air, as in through the HVAC system, or by irradiating surfaces or objects. And the disinfectant effects, like I said, depend on a number of variables. The dose, like the intensity of the UVC light applied, the duration of exposure. Certain microbes, for example, need more exposure time than others, and the presence of shadows or dust or anything that might block the light from directly reaching an organism. So this type of light would be most effective on clean surfaces that have been cleaned, free of dirt, free of grease, that would otherwise protect those organisms. This is an example on the left here of an induct cooling coil system. These are most effective when used in buildings with mechanical systems that recirculate air. Of course, we want to limit recirculation as much as possible. And again, the efficiency is affected by airflow rates, the closeness of the light bulbs, and the placement of the lamps. And again, I want to emphasize, if air is flowing through here at a relatively rapid rate, and if an organism needs a certain amount of exposure time, we might not be destroying an organism if the lights are in the UV system with continuous airflow, which is currently what's recommended. These are often used in settings that are humid, where facilities want to prevent the growth and development of things like mold in the HVAC system. This machine on the right, I've seen more news stories about this type of machine. These are portable and controllable and programmable UVC lighting on wheels. And these are pretty good for disinfecting objects, complex surfaces with lots of different angles that might be hard to reach. Again, with these types of devices, we want to make sure that humans aren't in the room when they're working, that humans aren't exposed to this light at the same time, including during setup. So the most commonly used type of UVGI lighting in the healthcare setting would be upper room lights. And I've provided a link here to the NIOSH guidelines for hospitals specifically for targeting respiratory diseases. This image here on the right is an example of what a UVC light might look like. And here, the lights are pointing up. So, pardon my art skills here. So in this case, this is the breathing zone, right? But we want the air to circulate so that those respiratory droplets are directed upward into the light system, so that when the air recirculates down to the breathing area, those respiratory droplets have theoretically been killed or destroyed, or at least their DNA has been destroyed. So in summary of UVC lighting, overall the literature shows that this light can be effective in killing the virus depending on the dose, the duration of exposure, obstruction of shadows and dust, but things that need to be taken into consideration include that exposure to UV light can be harmful to eyes and skin, and that occupants of a room where it would be used need to be shielded. And UV light, UV GI systems, some of them generate ozone and other free radicals, which when inhaled also pose other health risks. And most importantly, there's no set standard, there's no clearly defined set of recommendations for schools to use this type of technology. Everything that we do and recommend is around best practices based on research and evidence, and we simply don't have the research and evidence around this technology being used in schools. So another set of tools that I've seen presented quite a bit lately and that I've heard or I've received inquiries about are foggers and electrostatic sprayers. So an electrostatic sprayer, which I don't have an image here, they've emerged as an alternative means to apply a disinfectant. Basically, the disinfectant spray system uses electrodes and it applies a charge to the particles of the disinfectant. And the charge, I guess, results in forces stronger than gravity so that the droplets can wrap around a surface more effectively, leading to a more even distribution of that disinfectant. And if a virus is enveloped by detergents and solvents, that's an effective way to destroy its outer lipid or outer fatty layer, basically. So no studies have been, I guess, rewind. The research shows that these sprayers are an effective way to evenly distribute the disinfectant, as opposed to the handheld sprays. But no studies have been found, or I didn't find any studies that compare the effectiveness of electrostatic spray systems with conventional spray systems to actually inactivate COVID-19. If they're going to be used, they should be used on surfaces that have already been cleaned to remove other debris and dirt. And while they're promoted to result in more effective distribution of chemical and theoretically then more effective inactivation of the virus, there are a lot of variables to take into consideration. So if someone's going to consider using these, the most important thing to keep in mind is that you need to read the instructions, you need to read the manufacturer's guidelines. If a very specific type of chemical is supposed to be used in it, then you use that specific chemical. You don't want to mix substances with different machinery. It's really important to follow instructions. And also, it's also what I haven't seen advertised is the importance of using proper PPE with these machines. Foggers are also being sold, and I'm a little more weary of foggers. So a fogger, the most common type of fogger that I've seen out there would be like a bug bomb, which hopefully, well, most of us are probably familiar with. You've got roaches, you want to get rid of them, you put the bomb in your house and you take the family and the animals away for a couple of days. It produces a vapor of, well, various forms of vapor, and that chemical kind of floats around in the air and then eventually it settles. Again, if a company or an institution is going to use a fogger, they must read the instructions, they must use proper PPE, and for an industrial type of fogger, we really recommend that the person using them be formally trained in how to use it, not just read the instructions and go, but actually go through a training process on how to properly use it. And often foggers are sold with proprietary chemicals that are put in them. There are some risks about using proprietary chemicals, but in this case, you would want to look at safety data sheets and make sure that you are applying the proper dilution to the chemical, and that again, the person using them is properly trained, and that no people are occupying the rooms or the neighboring rooms where these might be used. So I put out a lot of caution when people ask about using these machines. We've received some questions about the use of ozone generators. An important point, when they're used at concentrations that don't exceed public health standards, ozone applied in an indoor setting isn't going to remove a virus, a bacteria, mold, or other biologic pollutant. So if an ozone generator is being used to eliminate an organism indoors, when used at concentrations that don't exceed public health standards, they're not effective. So they're not recommended for occupied spaces. Ozone, again, is a respiratory irritant, not just for people who have asthma, although it's worse for people who have asthma. And per the EPA, there have there are no devices that have been approved in the US for use in occupied spaces. And if they are going to be used, and I'm not recommending they be used, but if they are going to be used, then once they're used, that space needs to be really well ventilated and aired out before anyone comes into that room or neighboring rooms. Somebody asked about plexiglass partitions. I think Sherri pretty much said everything that needed to be said. They need to be as high as the tallest person's breathing zone. They need to be cleaned regularly. They should be considered contaminated. Any pass-through spaces need to be as small as possible. And then most importantly, if you're considering putting these in, you should talk to the HVAC specialist that you work with to ensure that these partitioners don't affect the airflow that's already happening in the room. So a lot of references. And I've got a list of resources, some of which will actually be emailed to you in the follow-up email. And then this list of third-party organizations that might provide additional information for you all. And then our acknowledgements and disclaimers, no conflict of interest. Any questions?
So I posed a question in the chat, if those of you haven't seen it, just asking what techniques or protocols your schools have been using, and if you have any specific questions on communicating those COVID prevention protocols in your school or work. I know one of the things that has come up too, and this was mentioned, I think, a couple times, is these recommendations are kind of evolving, and sometimes it's hard to find the best information. So either, I know Dr. Friedman, you had some lists there. Are there any like top 1, 2, or 3 resources you guys recommend schools can monitor or go to find out like what the best recommendations are for prevention?
Us, of course. So Sherri and I are working with the American Academy of Pediatrics and in partnership with our Healthy Schools program at Children's Mercy to provide updated resources for school administrators that have questions. And I've actually put the Children's Mercy portal for schools in the chat box. So if people have questions that they don't find answered by the CDC or the AAP or other authorities on this subject matter, they can reach out to us, and someone from our team will answer those questions. I think pretty consistently we use the AAP and CDC, and lately we've been referring to ASHRAE frequently for HVAC system guidance. I don't know if you have anything more to add, Sherri.
Those are the main ones we use, and I used particularly Centers for Disease Control and Prevention information, and they tend to summarize from a lot of different sources, so you can look at them and then also go to the original sources.
Are there any particular challenges you guys have heard from the audiences you've talked to about some of the hardest things for schools in particular to communicate about? And I'm sure this varies a lot by geography and district, but I didn't know if there was anything that had emerged as a really common challenge around that. You know, thinking about not just implementation, but just actually talking to the community and to parents about those protocols.
Well, I don't know that this is so much as a challenge. It's just that the schools are receiving so much information and being bombarded with a lot of marketing. It's hard to tell, you know, is this a good thing? Is that a good thing? So I really do encourage, if they have questions, to enter questions in the Children's Mercy portal, school portal, and we will try and help sort that information out. But I think that may be one of the biggest challenges, and they want to use their money wisely. A lot of this equipment is very expensive. So if they're going to make that kind of investment, they really have to do homework and talk and look at the research, the efficacy, and really, is it worth the investment and not cause harm. Elizabeth?
I think that covers it well. Maybe the other point that I don't know if this is a challenge either, but you know, there's the risk and benefit, and you know, how much do we actually have to spend on upgrading an HVAC system? And we've talked to some schools about this. You know, is it worth the upgrade? And I think before any upgrades are made or invested in, it's important to take a pause and make sure you're maximizing everything that you have available to you there. We've seen a number of schools that, you know, weren't necessarily putting their filters in properly, or weren't running their HVAC system as ASHRAE is currently recommending for the pandemic. So also just, you know, making sure that you take a pause and go and look at the basics before you dive into the more complex
For sure.
devices.
We do have a Q&A question, and this ties back to an earlier question around plexiglass. And it says, is it recommended that plexiglass barriers prevent, it says contact tracing. I think they mean spread, because contact tracing being the follow-up, you know, to people who maybe have been exposed. And I know we talked about that a little bit earlier. So if you guys can maybe just reiterate that, it may have been someone who joined late.
Sure. So I'm muted. Am I muted?
No, you're good.
Excuse me. So I'm actually just going to go back to my notes here. So plexiglass, so they can serve three functions, right? They intercept the respiratory droplets that might be transmitted from person to person when they're not able to social distance. It does reinforce that social distance, even if users aren't being mindful of that. And it reduces the reliance on masks, which when working with kids can be helpful, but they shouldn't be used with, like anything, they shouldn't be used without taking those really basic precautions that have been recommended, the ones that we hear ad nauseum: hand washing, mask wearing, and social distancing, and staying home if you're sick. So they're not a replacement, they're an additional tool.
Any other final questions people want to drop in the chat or Q&A? Hearing none, I will give you guys back about 10 minutes